is comfortable listening to music and studying, and he gets me the A, I don't care. I don't care, as long as he's not disturbing me or others, okay? But it is what the students are comfortable with. Like I told you, some students like to go maybe study on the beach or go outside or whatever. For me, no, I like to sit in my home and see whatever works, and we like to get to see the results at the end.
Dr. Abdullah, we have a call. Good evening.
Good evening.
Good evening, Joss.
Yeah. I was watching your program. It was so nice.
Thank you so much. I hope that you don't have any stress exams for you.
Okay, doctor.
Okay.
I just want to ask one question.
Go ahead.
That is, I am working in the media segment. I have a problem because I am going under stress in sometimes. Okay, I think it has affected to remember certain things. This is my problem. Is it a psychiatric problem or a physical problem?
Forgetting to remember?
Yeah, exactly. Information. I am forgetting information.
Information in your job, like in your project that you're working on, or forgetting different information that's not related to work? Like,
for example, sometimes it is related to my work, and sometimes it is related to my personal things. For example, it's a part of my job that to remember certain dates, important dates, and everything such, things like that. But last few months, I think last for 8 months, 6 to 8 months, I cannot remember these dates exactly. Before 1 year, I can remember everything clearly, but now it is difficult for me to remember certain things. One thing I know that now I am working under stress, very strain and stress is with me. Is it a problem? Is it a psychiatric problem or a?
Before you finish, just are you married?
Yeah.
Okay. My advice for you: don't forget anything regarding your wife, her birthday, or anything related to her. Otherwise, the stress will be very high. Okay.
Last time I forgot even my date of marriage.
Okay.
This type of things.
Okay. Wish you all the best.
Thank you
for calling.
Thank you.
Okay.
Forgetfulness or difficulty remembering things is quite a common symptom. However, it does not necessarily mean that there is a psychiatric disorder.
Okay.
The commonest cause for forgetfulness is someone who's like our viewer, who has too many things on their head. Just too many things to remember, very stressful situation. So sometimes when I'm having too many things, even I may forget something. If I don't organize myself and write it down, I will forget things.
So it's something normal.
So yeah, it may be a sign of too excessive preoccupation or having a very stressful lifestyle. Now, obviously, people who are getting older, old age people, their forgetfulness will become apparent. He was wondering about psychiatric disorder. The psychiatric disorder commonly that will produce poor concentration again or forgetfulness is depression. Now, in order for me to know whether there is depression or not, I need to know more information from the viewer, which I don't have right now. But if there is a change in his sleep, in his appetite, in his motivation to work, in his socialization, in his mood, then in that case, there might be a hint of depression. Otherwise, it is mostly just stress related.
In order for stress, when you have somebody who have too much stress, do you recommend to take a break, rest, short period vacation in order, to help himself, to organize things, or you recommend, to try to avoid stressful situations, like if you have too many things to do, to short the list of his duties?
Yeah. Again, it's if we go back to, related to our topic tonight about how to cope with the stress of the exams, again, it's a matter of coping mechanisms and techniques. For example, our viewer is working in a stressful job, apparently. Our students go through stressful time with studying, but it should not be the idea that they are studying continuously, because our minds and our brain has a limit.
Okay.
That's why, you know, any lecture should not go beyond 45 or 50 minutes, because beyond that 50 minutes, your ability to, you know, absorb the information goes way down. So for the studying, I always tell, you know, that my patients, my, you know, students, if I meet, is that, you know, you should not go for a lengthy time of period without a break. You should have a break, even 5 to 15 minutes. So you may sit down and do nothing, or go for sit outside, or, you know, talk to a friend, whatever you want to do in this 15 minutes. So you are back and, you know, refreshed to study.
To study again. Dr. Abdullah, we have a call from Fatma. Good evening, Fatma.
Good evening.
Yeah.
I have some problem during exams, which is that I don't have a stress. Like it's like I don't care about studying during exam, but I do care about passing the exam.
Okay.
But I feel like I need some stress to let me study, but I don't study, and this is stressful for me. I don't know. I don't have the drive to.
How old are you, Fatma?
I'm 26.
26. Okay. And what makes you think that you don't have the drive?
I don't know. Actually, I don't know. I think I'm overconfident or something. That I'm gonna pass the exam, although I'm gonna study very little. And it's really stressful during the exam, because I know that I didn't study at all, and I'm gonna be under such a stress during the exam. So I don't know what to do.
And your average grades are what? Your average grade?
I'm a C student.
C student.
Yeah.
Okay.
Okay. I'm a graduate, but I'm applying for a board.
Okay.
Fatma, before you finish, do you feel that you know, whatever you will do now during the last minute will not do anything, you know, in the exam? It's now, it's finished now. It's the time for the exam, and I can't do anything more than this.
Yes.
Okay.
I feel like I spend a lot of time playing around, and there is no time to study the whole subject.
Okay.
All right.
Okay, thank you for calling, Fatma.
Now, there is a difference between running late and feeling helpless and amotivated, and between not feeling motivated at all.
Okay.
You know, the first example, which is running late, is poor organization skills.
Okay.
Okay? And I don't know if she has achieved a B or A before, but if she did, that means that she has the capacity and the ability to achieve those grades. However, she's just not organized.
She didn't plan it well this time.
She is not organized. And this is when I was talking about the structure of exam and how to organize yourself. On the other hand, if she has no motivation at all, then we again, you know, I'm sorry, but depression seems to pop up every now and then. If she has no motivation to study, and there is no motivation in doing things, and no motivation to sit with her family, no motivation, then this is a bigger picture, and there might be an element of depression there. So again, she can choose which one of these scenarios fit her, but it will be one of these two.
So you recommend, like, you know, for anybody who facing this situation, to have a consultation order, you know, to...
If there are other changes, and if it is not specifically for studying, then...
Even the normal life in different situations, non-stressful situation, it's better, you know, to consult somebody.
Yeah, if the changes in their life go through their family, to their friends, that they don't feel like they are happy anymore, in that case, I think they should ask for a consultation.
Dr. Abdullah will take a break, then we'll come back to tell us the advices, you know, for all parents, how to cope and regarding the structural learning. Okay? Dear viewers, we'll have a break. Don't go away. After the break, we'll come back to discuss stress and exams. See you after the break. Welcome back, dear viewers. I would like to remind you that our topic tonight is about exam stress, and our guest tonight is Dr. Abdullah Gholoum, the head of the Psychiatry Hospital. And now we are coming to the role of the parents during the exam. Now we talked enough about the students themselves, and they are in stressful situation. Now let's talk about the parents. Now, the role of the parents during exam. What's their main role during the exam? I know the children are studying, but I'm sure that the parents will have a great role during this period.
It is well known, Dr. Mashal, that some parents have more anxiety about the exams than their children themselves. Okay. And it's a common thing that I see in my practice, that when when it's exam time, some parents are so stressed out. Do you
mean that the parents need more treatment than the students?
Actually, yes, they are so, their level of anxiety is so high that they just make everything so tense around the house, and that's definitely not healthy. I mean, exams are, to be taken seriously, but not too seriously. Okay. Again, in the intermission, we were talking about what are the what we can allow our students to have during their break time. They can watch a little bit of TV, that's fine. They can listen to music, as I said.
So it's fine for them to do some entertainment?
Again, within a limit. Within the structure, they should know what is the time allowed, what is this. And when I know the structure, my anxiety goes way down. When I don't know, whether I should watch for half an hour or 15 minutes or 4 hours or whatever, no. It should be, clear to the parent, the family, and their children, the students.
For example, Dr. Abdullah, let's say that they are coming after school and they have the exams, and can you tell them okay, you can study for 1 hour, then I'll give you 10 minutes break, then another 1 hour, then you can do whatever you want in another 10 minutes break?
Yeah.
That will be fine.
Yes.
Okay. Instead of doing all your studying, then at the end, if maybe I'll give you free time if you finished early.
You see, now different families have different, like say, schools of thinking or schools of thought. Okay. Now there are the very strict family, military family. Nothing is allowed. No TV, no music, no